Hi everyone, I'm Jaya Vishwanathan, and you've found the No Brainer podcast where I discuss all things neuroscience in delightful conversations with various experts. I hope you enjoy today's episode.
So many women experience mental brain fog, postpartum depression that we've talked about. And so I know you talked about the support from family, but what are there other resources available for women based on your scientific understanding of these processes?
Mm-hmm.
Yeah, what are some of the resources that people can access?
I think still that good support in this
Yeah,
period of time can reduce stress as well. I think women hardly have any time for themselves. They hardly really have time to get out to do something for themselves. That has to be supported as well. And
mm,
for sure, if women have a mental disorder, then they have to be supported by medical professions because in particular women with mental disorder, they experience stress differently, they process stress differently, they're
yeah,
more stressed out. We saw in our research as well that depression are associated with a higher level of stress. They're not only depressed, they're more stressed out, and that has immediately impact on the bonding to a child. They have a lower attachment to the child. And we can
yeah.
see as well if women are treated, if they feel better, or they somehow manage to get out of this postpartum depression, that not only mood gets better, they report less stress, they're less
Mm.
stressed out, and they have a higher bonding to the child as well. So that's those three factors are connected.
Interesting. Does the bonding with the father or the
Mhm.
partner, does that change with postpartum as well?
Mhm.
Or do we know much about that?
Yeah, I mean, women usually report, or we can see that
Yeah.
good quality of relationship is as well protective factor as well.
Mm-hmm. Okay.
So, like being a single mother is a risk factor for postpartum depression, or having a less support, or even this violence in a family. This is a risk factor for depression. Yeah.
Yeah. Yeah. And I noticed you had one publication about the fathers bonding with, or a couple of publications about fathers bonding with the child as well. So
Mhm.
if you can share your insights about that, that would be great.
So, we actually indeed have a male cohort.
Okay.
The papers are submitted, but most of them are not published yet. We built a similar fathers cohort and looked
Okay.
at the changes in the brain in fathers as well.
Okay.
And we could see as well that men can develop depression during this time of transition as well.
I
But they
see.
have different risk factors as well. In men, it's
Mm.
different risk factors which contribute to depression. In women, frequently indeed this hormonal switch, that's
Yeah.
like this baby blues, that's what they usually you can see postpartum depression in close relation to the birth of a child. In men,
Mm.
it's different. It's like cumulative factor. So if they have like a higher level of stress in this time, so they
I see.
develop depression, but maybe not immediately, not within the first 2-3 months, but later. So they're like it's like cumulative load which happens. Like if they cannot deal with the new situation, if there are like some personal problems, then the higher risk to develop depression during this period of time as well. And what we can
Okay.
see that so that depression affects bonding in men as well.
Yeah.
So it's a general thing. It's not like female thing again. It's not like only women bad
Yeah.
mothers. So if fathers are depressed,
Yeah.
because it's like during depression we have changes in networks associated with emotional processing, right? And it's
Right.
same in both genders. So depressed men, are less sensitive to their children as well.
Yeah. This is very interesting to me because I guess my next question is very related to what the last two questions were, which is from a like circuitry perspective, is the depression, because you can have depression, like major depressive disorder,
Mhm.
whatever, independent of pregnancy, birth. And so how different is the postpartum depression for both men and women? How different is that from like just a depression circuit or like the mechanisms of depression?
Well, it's indeed discussion like, is postpartum depression a different type of depression,
Yeah.
or it's a depression during this period of time? I think it's like kind of both,
Okay.
because the definition of depression is low mood. It's like a low level of energy, sleeping problems, concentrating problems. So that you can see in normal and regular depression, but that you
Yeah.
can see in postpartum depression as well. I think what is really special about postpartum depression, indeed, that this biological trigger, biological contribution, like this changes in hormones,
Yeah.
for sensitive, for vulnerable women, it is what can trigger depression even when other risk factors are lacking. So they have this
Right.
genetic predisposition. And what is very typical for depression as well, for postpartum depression, it's actually anxious depression as well. So they have usually more anxiety in comparison to like depression maybe during other times. That's what I can see. The
Okay.
most of postpartum women, they have higher level of anxiety,
I see.
and they special for this depression as well, that it is like everything is about child. So the focus, like they're like problems about developing a bonding, or sometimes they develop OCD thoughts, then they have the thoughts, impulses to harm the child, or constantly have this checking behavior that if the child is breathing, they're preoccupied with cleanliness too much, so they're actually constantly in this more alert stage. And I think that back to your very good question about biological function as well. I think the nature wants women to be more anxious after they give a birth to a child. So this anxiety
Right.
level is higher, it's there. So you can see it in healthy mothers as well. They're like more worried. The focus
Yeah.
is on the child. They're
Yeah.
like all about this small baby, and they're anxious. And it is like what nature wants.
Yeah.
Wants that you protect. Yeah, you're like, women are usually less aggressive, they're less about themselves, they're actually only anxious and preoccupied.
I
And in
see.
women who develop depression, it's like it's just overexposed, it's just too much. It's just not, it's getting out of control.
Yeah. Yeah. No, that makes so much sense, and kind of like pain becoming chronic pain, right? Like the
Yeah, or like
anxiety that
too
you
much.
need
Yeah.
becomes too much. Yeah.
Yeah.
That's very interesting. So, as you're working in this very new-ish research area, what are some of the challenges and promises of working with this cohort studies and neuroimaging and also multimodal? So imagine, yeah,
What about challenges? Challenges is indeed to keep going, to find good people who believe in your research, right? Because I cannot do
yeah,
it only by myself. I need,
of
I
course,
need good PhD students. For the PhD students, I need money, so you're constant in a process of raising funds. I was very lucky last years, really got good grants, but it is like you always have to be 2, 3 steps ahead of your time, because if you got a grant now,
yeah,
you have to start working on the next one, right?
yes,
Because maybe you secured your situation for 2, 3 years,
yeah,
but this process of grant evaluation takes time. So you
yeah,
actually constantly has to keep writing grants. It's very competitive. Yeah, and I mean, in my situation, what I experienced to be very challenging as well, I'm not only working as a scientist, right? I combine this clinical work and science.
yeah,
So it's a great combination,
yeah,
because that's what helps you just to see both science but women as well, like work practically. But it is sometimes, in terms of time coordination, not easy.
yeah,
So it's a lot of work.
yeah, yeah. I mean, yeah, most rewarding work can be, right? One thing, that struck me is, and this might be futuristic, so no worries if you don't have the answer to it, but like I work in like dementia and Alzheimer's space, and I know that like depression is a risk factor for developing late life brain issues, dementias, things like that, and also just brain health in general. And like people who are depressed, they don't get enough exercise, and then that can be a contributing, they don't get good sleep. That can be a contributing factor. Have you looked at things like long-term brain health effects of women who did develop postpartum depression versus those who didn't?
No, we didn't do it yet because our cohort is relatively young, right?
I
So
see.
that's you need more data.
Yeah,
But I really strongly believe that mental health and aging health starts during pregnancy a lot,
I see.
I think that's all these factors which happen in pregnancy, like even these metabolic changes, right?
Right.
High blood pressure, tendency to develop diabetes. A lot of women indeed do not have a healthy diet, and they have a lot of complications, right? Including too extensive weight gain. All of that can contribute to development of depression, but
Yeah.
basically such conditions, they can become after pregnancy chronic, right?
Yeah.
There's some metabolic changes, and it's not, if you like not watch out, if you're not careful, so you stay in the states and you don't get out of like this metabolic problems. I mean, a lot of women report that they cannot lose weight after pregnancy, or like
Yeah.
they have problems of high blood pressure or high sugar, and all of that factors which can later to contribute to aging of a brain, to
Yeah.
development of dementia, and it would be visible particularly then when you have less estrogen in age. Like
Yeah.
women in menopause, they have more cognitive problems. It has to do with a lack of estrogen. So
Yeah.
basically taking care of mom's brain, of healthy
Yeah.
brain, that they live healthy, that they treat themselves nicely.
Yeah. Yeah.
It's a good protective factors later for
Yeah.
development of later, I mean, dementia as well.
Yeah.
Women are under higher percentage of development depression in comparison to men.
Yeah, for sure. No, that's interesting, and I'm glad you brought up menopause because I see that women's bodies go through so much, like first puberty and then pregnancy and then menopause, and all of these drastic hormonal changes are constantly rewiring your brain based on like needs or whatever. Is there an element of resiliency that you see as well, or?
So, I mean, please repeat your question. Maybe I didn't get
Yeah.
it entirely.
Yeah, so it's also a very philosophical question. So, like we go through puberty and then a few years later pregnancy and all the changes, and then menopause and all the changes, and they're a lot more drastic. I'm not saying males also have their hormonal
Yeah.
cycles and changes, but women's are a lot more drastic. So, do you see features of resilience in the brains or bodies of women that are kind of a message of hope, if you will?
Yeah, I mean, I think the women are very, very resilient for sure. Not sure how it's connected to hormonal changes, but
Okay.
I think maybe that has some adaptational mechanism as well. If women have constantly adapt themselves
Yeah.
to this situation, so they like kind of learn how to accept a lot of things which are, there's a lot of unpleasant things which happens associated with this hormonal changes, and
Yeah.
they kind of learn to deal with that. They kind of learn like to accept that. It's like
Yeah.
actually a lot of work which needs to be invested, but
Yeah.
not all women can do it well, right? I mean,
Yeah.
there's some women who are just really suffer under these conditions.
Yeah, yeah, absolutely. And I know that there are variations in things like premenstrual
Yeah.
pain or menstrual cramps and things. So there are individual variations there. That's for sure. So speaking of that, like I know you mentioned that premenstrual tension and depression can be risk factors. What are some of the other risk factors for actually developing postpartum depression and things?
So generally mental health, I mean, if it was
Yeah,
some mental problems before, there are risk factors for depression, abuse, trauma,
yeah,
actually all factors associated with depression, there are risk factors for postpartum depression. The specific is indeed these hormonal changes,
yeah.
but trauma, abuse, neglect, lower
Mm,
level of education,
mm,
lower social support, lack of money, all of that are risk factors.
Yeah.
being actually a minority as well. Like, yeah, I mean, we have a much higher number of depression indeed under women and not German women, right? And
I
frequently you
see.
cannot even reach them in terms of because of the cultural barriers plus language.
Yeah.
So that's, I think, a hugely under-investigated subject because the most of the studies are actually done on educated German women, right?
Yeah.
So we are not talking about all this social supporters, asylum seekers, and whatever. I mean, the number of depression and problems would be there much higher.
Yeah, that's very fair. So you talked about it a little bit earlier about the changes for the mother-child bond. And so can you talk about the main results of that study that you
Mm-hmm.
did looking at specifically the mother-child bond?
Mm-hmm. Mm-hmm. So, I mean, first on this behavioral level, we could see that if women does well, if she doesn't have risk factors, if she doesn't have any mental disorder, then usually this woman has a higher bonding to a child. That you
Okay.
can see that like actually more resilient, healthy women, they have a better bonding to the child. That's you can
Right.
tell out of this cohort. And we could say as well that for instance, volumetric changes in amygdala, subgenual prefrontal cortex, and hippocampus, they can predict the quality of a mother-child's relationship. So if those areas like more dynamic, if there are more dynamic changes in this area, so that's
Yeah,
actually associated with higher, better bonding to the child.
I see.
If you see this dynamic in this area, somehow this can predict better attachment.
Oh, cool. And you mentioned earlier about machine learning approaches. So,
Mhm.
how are you using machine learning or AI approaches to look at these data? So, you have just to refresh memory, you have 1,000 plus women,
Mhm.
and you have neuroimaging data and hormonal data.
In
Yeah,
behavioral data as
and
well, right?
behavior. Oh, okay, behavioral data. Okay.
So, I mean, what we did and this prediction and the behavioral data, we actually collected data over longitudinally, right? So it was
Yeah,
time points, and to each time point we would collect number of data.
yeah.
And with machine learning, we will ask to which time point, so as early as possible, and which combination of factors can predict postpartum depression.
Wow.
So in this machine learning included as well, we did such things like monitoring, online monitoring of mood and stress. We really asked women every second day, how do you feel on the scale from 1 to 10, and how
I
you're
see.
stressed out from 1 and 10. So we had actually a number every second day. And a combination of this could tell us that if you have a woman at high risk for development of depression, for
Mm,
instance, maybe she has history of depression, and if this woman stays in touch with you, and if she and this online monitoring every second day for 3 weeks would tell you, I don't feel well, she's depressed. So
yeah.
that's what you can say. So basically using such as things like ecological monitoring or apps, um,
Hmm.
based on that, is if women continuously say during this period of time for 2-3 weeks, I don't feel well, it's a very high predictor of depression. And the machine learning tells you that as well, right? So if you
Yeah.
combine it, for instance, with stress factors of a bonding, then you can recognize up to 90% of depressed women already around 3 weeks postpartum.
Yeah. Yeah, that is fascinating. So, what advice would you give to people who might be interested in careers such as yours or in pursuing this type of research?
Well, I think they have to look for a good group. So they
Okay.
have to like work with somebody who does good research, right? And it's not always big universities, sometimes like a smaller group, like
Yeah.
mine, for instance. We work very focused on that. You have to bring a lot of patience and resilience because it's like a very long. I mean, first they have to get like a good preparation as well in terms of studies. I mean, medical studies one of the options, and being psychiatrist one of the options. But for instance, to become a neuroscience, if you did
Hmm.
some areas of neurosciences, would be a way to join this type of research. And Yeah, you have to like bring some certain level of resilience to understand that you really have to invest time. It's a very time consuming research because, for instance, alone collecting, recruiting such a high number of participants, it's already
Yeah.
a lot of work. And yeah, I mean, it's actually, I mean, I think I'm actually very honored as well that people get in touch with me and we actually have a good publications and I'm
Mm-hmm.
getting grant. But it remains to be tough somehow.
Mm.
It's not easy. It's a very high competition. Very important as well to cooperate with others. You
Yeah,
know, to like if you work in this area, it's important not like to believe you're the best group. It's very important to work with others as well.
for sure.
It helps in terms of you have to be connected to this type of work which is done in the world because you have to be supportive for others and then others will support you. That happens when you apply for grants as well or submit publications.
Yeah. And so just the last question.
Mhm.
What are some of your future projects that we can look forward to? And do you have any other final thoughts to share?
You know, I'm indeed shifting a focus a little bit from postpartum depression and looking at changes associated with menopause as well, or like changes associated with cycles generally. So, like what happens during the menstrual cycle in a
Okay.
woman's brain, it's one of these areas.
Yeah, so thank you. And can you please tell us about some of your future projects that we can look forward to?
In my future projects, I would like to study other factors contributing to female mental health,
Mm-hmm.
not only like birth itself, but actually other factors like physiological fitness and mental health during pregnancy and postpartum. But we're looking also at changes associated with puberty or during perimenopause, right?
Mm,
So how that's associated with mental health. And more increasingly, I actually working in oncology as well. I'm working as a psych-oncologist. So, and you can see that, so instance, like treatment of tumors, like breast tumors, can be associated with some negative effects for women mental health because, for instance, they have to take some medication which affects their hormonal levels as well. So that's actually
right.
another very interesting area, mental health in association with somatic diagnosis, like for instance, breast cancer.
Oh, wow. Yeah, that is fascinating. Thanks for sharing that with us. So that actually spurs another question. If you've looked at in your cohort women who were using oral contraceptives and hormonal contraceptives, if you found any kind of difference in their risk for postpartum.
Mm. No, I mean, like in our cohort, we didn't see that, but
Okay,
I know research is done in this area. Actually, I can send you studies as well who did this research.
sure.
You can see if women, for instance, have depressive symptoms as a side effect of a hormone
Mm-hmm.
depression. For instance, they take pills
Mm-hmm.
and that affects their mood stage. It could be a predictor for later depression postpartum.
I see.
These women are under higher risk to develop a depression if they have already this vulnerability toward hormonal contraception,
I see.
then they might quicker develop depression.
I see. Well, thank you so much for sharing all of your wisdom and insight with us. I can't thank you enough. If you're just tuning in, I've just had the most amazing conversation with Dr. Chechko about the maternal brain, the female brain, and how it changes through life, and some of the evolutionary and neurocircuitry changes through life. So thank you again. I'll be sure to include all of the publications that you mentioned in this talks in the show notes, as well as a way to contact you. But again, thank you so much for taking the time. I think our listeners are really going to appreciate hearing from your expertise.
Yeah, and thank you so much for like being interested in that and
Of
like
course.
doing so much work as well to inform others about this field and about this research. So stay in touch.
Absolutely. Thank you again.
Thank you. Bye bye.
Hey everyone, hope you enjoyed this episode of the No Brainer podcast and see you at the next one.